Mark Scar on KIOW. It's time for House Calls, bringing health care to you. Your health, our care, a lasting partnership. And today, we're talking to Dr. John Brady. Dr. Brady, welcome to the show.
Thanks, Mark.
Dr. Brady provides treatment and care for the whole family at medical clinics in Britt and Garner, and our main topic is annual physicals. And I'm sure you get this question a lot, but if I'm healthy, why should I schedule an annual physical?
That's a good question. I certainly understand why a person would wonder why they need to go see the doctor if they're feeling fine, but an annual checkup will offer your healthcare provider an opportunity for primary prevention, meaning preventing disease before it happens by addressing risk factors in otherwise healthy individuals. Many conditions such as heart disease, high blood pressure, and others can be without symptoms until they become serious. So by having an annual checkup, your provider can work with you to potentially prevent these illnesses before they occur.
Doctor, I'm sure a lot of people hate to admit it. Probably a lot of us haven't been to the doctor for a few years now. So what can somebody expect at an annual physical?
At an annual physical, your health care provider will review your health history, review your family history to determine if you're at any risk for certain diseases, review and ensure your immunizations that are up to date, measure your blood pressure, weight, visual check, and other tests depending on age and other risk factors, discuss healthy and unhealthy behaviors such as smoking, substance use, diet, exercise, and other behaviors that can increase or decrease your risk of illnesses, and counsel for disease prevention. Conditions such as heart disease, diabetes, and some types of cancer can potentially be prevented with certain lifestyle changes.
So when I go into the clinic for an appointment, how do I make sure I get all my questions answered?
I encourage my patients to make a list of questions in advance of their appointment and to be sure to prioritize what is most to least important. You might even want to make it very clear at the beginning of the visit what you really want to discuss. On the flip side, you should allow time for your provider to address their top concerns about your health. They may have important information to share regarding a blood test or a new medical recommendation for you that is worth listening to.
Any final thoughts, doctor, about annual physicals that you'd like to share?
Besides the health benefit of physical, a regular checkup gives you the opportunity to develop a trusting relationship with your provider. This trust encourages discussion about medical concerns and treatment options, which will lead to better care now and for the future. If listeners would like any more health information, I invite them to our website at www.trusthchchs.com. Our healthy living tools on the website includes a symptom navigator, health risk assessments, and a drug interactions database.
Dr. Brady, thank you for the information, and thank you for being with us today.
Thanks, Mark.
And this has been House Calls, and our guest today has been Dr. John Brady. Dr. Brady provides treatment and care for the whole family at medical clinics in Britt and Garner. And this has been House Calls, bringing health care to you. Your health, our care, a lasting partnership. On behalf of Dr. John Brady, I'm Mark Scar on KIOW.